Welcome. I am Lucinda Curran, your host for the Environmental Sensitivities Symposium, a world-first event. And today I have the pleasure of introducing you to Dr. Carlo Rinaudo. Hi, Carlo. How are you?
Hi, Lucinda. Thank you for having me here.
Oh, it's an absolute joy to have you here. So let's talk about the work that you do. Could you please tell us more?
Certainly. Well, I get asked this question a number of times, and the easiest way I answer it is this, is that, in essence, I like to think that I help people's brains work better. And hopefully after today's talk, I'll shed some light on how significant the brain is on the immune system. And when it's not working too well, our immune system is compromised and increases the risk of environmental sensitivities.
And how is it that you came to do the work that you do?
Well, I'm a registered chiropractor and have been for over 15 years, and I have a special interest in patients with neurological conditions and associated symptoms with their health. I should note that I'm not a medical doctor or a neurologist. I just want to be clear with that. I started this fascinating journey about brain function over a decade ago. I was a chiropractor for over 5 years, helping people with a variety of musculoskeletal and spinal-based problems, and wanted to know why some treatments would work and why the same treatment for others wouldn't work. I also wanted to know why some of the clients with other symptoms like sinus issues, allergies, brain fog, poor memory, poor gut function, women-related issues seem to improve at times with the chiropractic care that I was providing. So not necessarily wanting to rely on outdated principles that many chiropractors have used in the past, I wanted to know more. And I learned many years ago through many mentors that the quality of your life is determined by the quality of the questions. So I began to explore why is this so? What makes people tick? As chiropractors, we sort of focus on the spine, and that's an area of our domain. But I thought there's got to be something a bit more to this. It's not always a bottom-up. It could often be a top-down problem. And our training in chiropractic, whilst it's a 5-year master's program, is quite detailed about some of the neurological conditions and processes. It didn't quite explain why we see what we do in our practice. So it led me to looking into how the brains function. And I guess with a lot of physical therapists, psychological therapists, and medical practitioners, the brain is the common thread that we have amongst all of us. So it's a great starting point. It's an area that's been covered for many, many decades, if not longer. We have the ability to draw upon a lot of that research from other health fields and apply it to what we see in our practice. I should also say that the difference between sort of a medical doctor and, I guess, a medical neurologist to someone like myself who would describe themselves as being a functional neurorehabilitation practitioner or a functional neurologist. There's different names given to it. But essentially what we do is we look at the shades of grey of function rather than someone presenting with an end-stage condition like cancers, tumours, strokes, Parkinson's, that are all what I would describe as an end stage. What we do is look at the subtleties of how the body and brain are functioning, and then we can apply a suitable therapy to help correct that or at least modify that as best as we can. So some 10 years ago, I started reading various teachers both here in Australia and overseas and started reading a lot of the literature on neuroscience, on how the brain works and how it relates to people's function. And it led me to a group within the States being taught by Professor Ted Carrick, a Canadian chiropractor who some 30 years ago developed a novel approach in helping people termed functional neurology. So my training led me to both in the States and here in Australia to be taught in the diagnosis and assessment and treatment of people using these various techniques. And over these years, I've been fortunate enough to teach people and be taught further in the States, training within various centres, brain-based condition centres in the States, and also taking further training in other forms of conditions like movement disorders, traumatic brain injury, vestibular rehabilitation, children with learning and behavioural issues. So my my focus at the moment is essentially, as I said before, is really help people's brains work better, and my training has hopefully enabled me to do that.
Could you talk to us a little bit more about, you mentioned the bottom-up and top-down sort of approach with this. Could you explain a little bit more about that, please?
Yeah, happy to, and I think it's quite a great question to sort of explore a little further with obviously the topic of the symposium. I guess a lot of us look at, someone presents with a particular condition, like for instance a gut-related problem. They have bloating, or they may have a rash on their body, or they may have a spinal-related problem like a neck pain or a lower back problem. And they may see their relevant specialists or allied practitioners or medical practitioners in each of those areas, and each one will go through an algorithm of what it could be, and perhaps with that then tailor a care plan or treatment according to that. And it may be, okay, well, the gut's not working too well, let's look at some antacids, or let's look at some supplements. There's a rash on the skin, well, let's put some cortisone cream or ointment on the cream and see if that improves. The back sore, let's go through a course of spinal manipulation or some exercise, and let's see if that improves. And fortunately, for a portion, depending on the condition, that therapy can be quite beneficial, at least symptomatically at the very least. But either that problem returns, or worse still, actually doesn't get better. So, and that's a very segmental way of approaching healthcare. There's the symptom, let's provide some care, and let's try to get it feeling or working or looking better. I guess what we want to try to do is look at what's controlling all this. Is there a common thread? Is there, as I describe it, a supra-segmental influence? So rather than a segmental influence, is there a supra-segmental, which basically means, is there something working above the problem that's influencing its state? And the common thread with a lot of this is the brain and nervous system. I hope we all can appreciate that. Every tissue, cell, organ, muscle and function of the body is controlled by our brain and nervous system. So it makes sense that we should at least examine this, or refer to someone who can, and provide treatments and therapies based on good solid neuro research and some evidence-based work, and then apply it in a way to see if it changes those people's symptoms. And I'll go through the talk, particularly that relates to the immune system and particularly the gut function, how we can do brain-based assessments and brain-based therapies that actually can influence greatly the function of these areas. That's something that I'd like to certainly discuss throughout our talk today.
Thank you. And you talked too that you're not really looking at what you're calling end-state conditions. So I'm understanding the functional neurology side is looking at the mechanistic side of things, the way things are actually working before they reach that point. Is that correct?
Exactly. In saying that, though, we're also trained, and our registration and our training provides this, that we are also able to diagnose or at least refer when we suspect pathology, because we may be a primary care practitioner, that the patient presents to us with something that they are unawares of. So we need to also say, this doesn't look normal. We need to investigate this further, and I'm going to refer you to these people to investigate that. So we also do detect people with pathology, but most of the time people will come to us with a particular known condition. So we can also help manage people's pathology as well. So whilst we certainly don't profess to curing someone's cancer or stroke, but we certainly can improve their function such that they can have a better quality of life. But going back to your point, an example of a functional state is one of the earliest signs of someone with Alzheimer's or Parkinson condition is actually gut problems. And there's a lot of research now that looks for early warning signs of people suffering from various neurological and neurodegenerative disorders. And they're now finding that the gut, eye movements, certain little early signs that we think of as being just a normal stage of age, or that's nothing, that comes and goes. These are actually early warning signs that the body is going through that process. And it's important that the trained practitioner identifies this and investigates it further. Now, not to say that we need to scan everyone and we need to put them through the rigmarole of every test under the sun, but we need to be aware that don't just look at someone when they've got a problem, but actually look at them and look for the subtleties in the way they're processing their thoughts, in the way they're moving, their balance, their control, their eye movements, their gut function, their hormone levels. These are all signs that the body is not doing too well, and it could be one of the earliest shades of grey that maybe we should do something about it.
That makes a lot of sense. So really, it's about being acutely aware of the person. So they might say, come in with a sore back or whatever, but you're looking at them in a bigger way to pick up anything else that might be going on. Is that right?
That's exactly correct. It does take experience, and it does take a good observation skills, I think, as any good clinician should have, to note some subtleties that the patient may fob off as being, that comes and goes, or, I tripped over the other day, I didn't think anything of it, or maybe I wore the wrong shoes. But in fact, they may be having some underlying neurological condition or the early signs of it that's leading them to this. So we're acutely aware of that, and a detailed examination hopes to identify some of these precursors to poor health.
And I think that's really important. My background is as an early childhood teacher, and I know one of the things that we highly valued was getting in early with any sort of treatment or interventions, because it was better than waiting till later. It was, you're better able to get on top of things. Is this the same with your work?
Very much so. Our practice with various other practitioners that we have in our clinic, we do see a lot of kids, and we love to see kids, and we typically see them with the views of neurodevelopmental aspects, and we're looking at, are they providing the basis and the foundation of growth and development and movement and cognition later in life. And when you look at an adult population, at times we think, I wish we'd got you at an earlier stage, because we feel that perhaps some of these problems may have arisen from a younger age, sometimes even from very young in age, and they've compensated or tried to compensate over these years. So, yeah, definitely, prevention is always better, and earlier the better.
And then the same would apply for adults as well, yeah?
100%. So with, people that are interested in your work, there are probably a lot of subtleties in what they experience probably 5 or 10 years prior to their onset of their environmental sensitivities that may have been a little warning sign, a little window to say, perhaps this is something I should have looked at a little some time ago. And it could have been sinuses, it could have been allergies, it could have been gut function, it could have been brain fog and moodiness and all sorts of things. And whilst there's obviously many reasons why these things can occur, more often than not there's a lot of comorbidities or a lot of associated symptoms that we see with people's symptoms and people's conditions.
And I'm hearing really it's a lot about being under the care of a skilled clinician to actually help recognise this and help take action early before problems really present.
As always, yes, there's no substitute for having a patient in front of you, and you can have a chat to them about things and getting a good insight as to their background, familial background, lifestyle. I think a lot of our problems that we see in our life nowadays are based on environmental and lifestyle influences. So going through and asking those sorts of questions about what they've been exposed to, what they have done, what they haven't done, gives us a good insight as to when and how some of these degenerative conditions have commenced.
Thank you. Everybody, Dr. Carlo Rinaudo will be a speaker at the Environmental Sensitivities Symposium. To find out more, you can go to environmentalsensitivitiessymposium.com.